How to minimize the complexity of text in messaging. This video is designed to increase awareness about the communication and literacy needs of people who read or listen to information with understanding below a third grade level, including people who have cognitive or intellectual disabilities. To meet the needs of this audience, guidelines for minimizing the complexity of text were prepared by the Center for Literacy and Disability Studies Department of Allied Health Sciences, School of Medicine, University of North Carolina at Chapel Hill. 1 in 4, or 26% of people in the United States have a disability. People with disabilities are the largest minority group in America. This group cuts across racial, ethnic, religious, gender, and age boundaries. Anyone can become a member of this minority group at any time. Intellectual and developmental disabilities. Over 7 million people in the U.S. have intellectual disabilities caused by conditions that impair development of the brain before birth, during birth, or in the childhood years. Intellectual and developmental disabilities, IDDs, are disorders that are usually present at birth and that uniquely affect the trajectory of the individual's physical, intellectual, and/or emotional development. Many of these conditions affect multiple body parts or systems. Examples include nervous system disorders such as cerebral palsy, Down syndrome, autism spectrum disorders, and more, as well as sensory systems, metabolic, and developmental disorders. The need for independent access. More than 1.1 million people with IDD live in the community by themselves or with a roommate. They need independent access to information in times of emergency and to support their general health and wellness. Literacy considerations. Approximately 52 million adults in the U.S. have basic or below basic reading skills. Below basic means reading only simple words and phrases in familiar contexts. Reading comprehension is consistently the academic area with the lowest outcome for all adults with disabilities. By the end of middle school, reading skills of students with intellectual disabilities stabilize below third grade level. Plain language standards. Although plain language standards exist and are used widely, generally plain language texts have a readability score between 6th and 8th grades. Developing guidelines for minimizing the complexity of text. To address the literacy needs of people with intellectual and developmental disabilities who need to independently access information in emergency situations or during a health crisis, such as the COVID-19 pandemic, researchers at the Center for Literacy and Disability Studies Department of Allied Health Sciences at UNC, in partnership with Center for Inclusive Design and Innovation at Georgia Tech, created a set of authoring guidelines that addresses the needs of adults with very low literacy skills, especially individuals with intellectual and developmental disabilities who live independently or otherwise need to access information independently. The goal of the Minimizing Text Complexity authoring guidelines is to provide authors with guidelines that focus on reducing the text complexity for low literacy readers. The guidelines aim to make the materials understandable to people who read at or below a third grade level, especially individuals with intellectual and developmental disabilities. Text complexity is different from text difficulty and text readability in the following ways. Text difficulty. Text difficulty describes the relative ease or difficulty of a text for a given reader. The difficulty of a text differs from person to person and task to task. Text difficulty is described as the interaction between the person, the task, and the text. Readability. Readability provides a general index of the relative ease or difficulty of a text without regard for the reader or task. Readability is most useful in sorting large groups of text based on the chosen metrics. Readability gives weight to text features that can be problematic. For example, shorter sentences reduce readability scores, but they can also reduce cohesion. Shorter words reduce readability scores, but shorter words are not always easier to read or understand. Text complexity. Text complexity describes distinct properties of a text that exist regardless of reader or task. The properties that impact complexity include vocabulary, word density or the number of different words, sentence length, and text length. An overview of the Minimizing Text Complexity Guidelines. These guidelines focus on complexity of the text rather than text difficulty or text readability. The guidelines offer detailed approaches regarding whole text level, word level, sentence level, document level, punctuation, layout, graphics, images, or icons. Whole text level guidelines. Whole text level guidelines include: ensure that the document presents information that is directly relevant to the lives of the intended audience. Ensure that the document has a clear, singular focus. Identify key concepts and divide into separate sections or separate documents with single levels of meaning. Divide the document into sections focused one single idea or topic. Minimize the overall length of the document as much as possible. Write in the active voice rather than the passive voice. Example: passive. The test will be conducted by a trained assistant. Active. A trained assistant will conduct the tests. Write headings as informative statements and use them to organize documents around key concepts. Try to limit headings to 8 words. Example: original. What is the difference between influenza, flu, and COVID-19? Revised. The difference between flu and COVID-19. Maximize cohesion in the text through the repetition of content words from sentence to sentence. When a new sentence does not relate directly to the prior sentence, start a new paragraph. Avoid bulleted lists and write a series of complete, parallel sentences instead. Sentence level guidelines. Sentence level guidelines include: limit each sentence to one key point. Sentence length should be 8 to 10 words. Only use complex sentences when required to support understanding of causal or other relational concepts. Repeat sentence types rather than vary them. Avoid negation entirely, including using the word not. Original: this is not all possible symptoms. Revision: there are other possible symptoms. Avoid words such as hardly or barely. Original: he could barely breathe. Revision: he had difficulty breathing. Avoid using no, none, neither. Original: there are no other answers. Revision: this is the only answer. Only use pronouns when the antecedents are located near the pronoun. Use personal pronouns sparingly. Avoid figurative language entirely, including simile, which compares two things with like or as, for example, as cold as ice. Metaphor, which compares two dissimilar things, for example, a marathon, not a sprint. Hyperbole, an exaggeration used to add emphasis, for example, so sick you'll want to die. Personification, giving human characteristics to non-living things. Word level guidelines. Word level guidelines include: ensure that at least 92% of the words are among the most frequently occurring words in written English. Use words with the fewest possible syllables. Find alternatives to medical and public health terms, for example, by using Center for Disease Control's everyday words for public health communication, or National Center for Environmental Health Agency for Toxic Substances and Disease Registry's Environmental Health Thesaurus. Use a standard online thesaurus or the tool built into Microsoft Word for non-medical terms. Use concrete words rather than abstract words. When complex or technical words are required, use no more than one in a sentence. If you must use a complex or technical word, define it in the text. Avoid using different words that have the same meaning. Instead, use a single word repeatedly. Minimize the use of graphics. Only use graphics such as line drawings, photos, or full-color images when necessary to support understanding. Select graphics that can be understood independently of text or explanation. Avoid graphics that communicate negation, for example, graphics with a red X covering the image. This is consistent with the guidelines to avoid negation in the text. Avoid icons or other conceptual symbols or graphic images. Using the Mtc Guidelines. To use the Mtc Guidelines, begin by analyzing the original document at the whole level. First, divide the document into single focus or individual topic sections. Next, identify relevant sections for the target audience. Compute complexity metrics for the entire source document using the sentence level and word level guidelines. Compute metrics. Compute metrics include the average number of words per sentence, the average number of syllables per word, percent of words that are high-frequency words, number of different words divided by the total number of words. Readability. Next, identify the elements that must be addressed to decrease the complexity. Work with other authors to review, revise, and redraft. Examine text content and features. Ensure that you have identified the most pertinent details. Divide the text into segments with a single focus or single topic. Identify text features that must be simplified, for example, use of bulleted lists, use of negation, use of questions, links to external sources of information. Author the easy-to-read text. Write the simplified version of each segment of the text while applying guidelines to minimize word and sentence level complexity. Check the metrics segment by segment. Check the metrics for the complete text. Conduct multiple rounds of review and revision, working with other content authors. The complete guidelines can be downloaded at the following URL. To see examples of text that was simplified using this process, visit CDC COVID-19 easy-to-read resources at the following URL. Creating text information at appropriate levels can help people with intellectual and developmental disabilities access the important information they need that affects their health and wellness, and important information they need during times of emergencies. The Rehabilitation Engineering Research Center for Wireless Inclusive Technologies. The contents of this video were developed under a grant from the National Institute on Disability, Independent Living and Rehabilitation Research, NIDI-LRR grant number 90RE5025-01-00. NIDI-LRR is a center within the Administration for Community Living, ACL, Department of Health and Human Services, HHS. The contents of this video do not necessarily represent the policy of NIDI-LRR, ACL, HHS, and you should not assume endorsement by the federal government.